BSU Tonight. My name is Christine Keogh.
And I'm Antoinette Gagliard.
Tonight we're going to be talking a little bit about the history of genetic testing.
So the use of prenatal genetic testing started in 1970 when it was used to detect Down syndrome of the fetus. But it was linked to abortion, which made it controversial at the time because often if test results came back positive, women would choose to abort the child.
In the last 10 years, genetic testing has expanded significantly. In 1990, a genetic epidemiologist, Mary Claire King, discovered that breast cancer is strongly related to genetics. The two genes she found that increase breast cancer among mutation are the BRCA1 gene and BRCA2 gene. After her discovery, scientists found that there were other gene mutations linking predisposition for other diseases such as colorectal cancer, Alzheimer's, other forms of dementia, and certain types of heart disease.
Most people are aware of some genetic disorders such as Down syndrome, sickle cell anemia, and Huntington's disease. The disease we'll be learning about tonight on our show is Tay-Sachs disease.
Here's a little presentation to help educate you. Enjoy!
Hi, come in.
Hello, are you Dr. Jones?
Yeah, are you Mrs. Smith?
Yep, that's me.
Hi.
Nice to meet you.
You too. So, tell me what's going on.
All right, well, my husband and I decided that we're ready to start a family, but my doctor suggested seeing a genetic counselor first. She says I could be at risk for Tay-Sachs disease, and I'm a little alarmed. Also, I don't really know a lot about genetic testing or how it works.
Okay, so genetic testing basically looks for alterations in a person's genes or changes in the levels or structure of proteins that are coded for by specific genes. And it's those kind of changes or abnormalities that are what leads to genetic disorders. As you've probably heard, you can carry an allele for a disease but not express the trait, which means that you might carry it and pass it on to a child, potentially, but it won't affect you. If you and your husband are both carriers, then there is a possibility your child could actually have the disease, or they could just be a carrier if either of you carry it. But that all depends on if it's dominant or recessive.
All right, so what puts my child or even myself at risk for Tay-Sachs? I'm not aware of anyone in my family having the disorder before.
Okay, well, since it's a genetic disorder, the way that someone's classified as at risk is by their ancestry and family history. So do you know your husband's family history by any chance, or his ancestry?
Well, I know that my husband's French-Canadian, but we're not really sure if they've ever been affected by Tay-Sachs or any other disease as far as my knowledge. But my mother is Irish, and my father has various Eastern European heritage.
Okay, so groups that are known to be at high risk are French-Canadian, Cajun, and the Ashkenazi Jewish population of Europe.
Uh-oh, my father was Jewish.
Well, that's not to say that your parents are carriers, but you may be at higher risk than some people given that your husband's parents are French-Canadian, you're not sure of his family history, and your father may or may not have been associated with the Ashkenazi Jewish population.
So how likely is it that someone would carry the disease if they're among this Ashkenazi Jewish population?
It's for every 27 members of the group, one carries it, theoretically, that's the ratio. Actually, there's an interesting fact about Tay-Sachs disease that was discovered among that group particularly, that it may be a protective factor against tuberculosis, and it's unknown why, but during World War II, tuberculosis was widespread in Eastern Jewish settlements, and because people weren't allowed to leave the ghettos, they were isolated. So the prevalence of Tay-Sachs increased at the time in that population because many were dying from tuberculosis, and incidence of Tay-Sachs also increased at the time, most likely because the carriers were reproducing among each other. Because tuberculosis was common at the time, people were exposed to it frequently, and that's a contagious disease, not genetic, so you can contract it from someone else. But it was found that often relatives of children that had Tay-Sachs didn't get tuberculosis.
Wow.
Actually, today it's said that 1 of every 250 people in the general population are carriers of Tay-Sachs. And although the 3 groups I mentioned are considered to be at highest risk, anybody can carry it.
Okay, so what exactly happens when someone is sick with Tay-Sachs?
Well, it's a disease of the nervous system. It occurs when a protein called hexosaminidase A is lacking, which is caused by a defective gene on chromosome 15. Tay-Sachs causes an excess of fatty substance to build up in tissues and nerve cells of the brain, which destroy those cells and cause mental and physical problems. There are three forms of Tay-Sachs disease, which they just depend on the age when the symptoms first appear. They are called infantile, juvenile, and late onset. The infantile form is the most common and also most deadly. In this case, nerve damage begins while the baby's in the womb, and the child will look normal at birth and continue to develop normally until 6 months of age. And about that time, the development will slow. At this point, the baby could have a reduction in vision and coordination and lack ability to outgrow the startle response. They also can lose the skills that they've gained, such as ability to crawl, turn over, sit up, reach their arms out. They may lose hearing, have difficulty breathing and swallowing, and by age 2, most children with infantile Tay-Sachs have recurrent seizures, loss of muscle function, loss of mental function, and they can become non-responsive to their environment. With the infantile form, the child usually dies by age 4.
That's terrible.
Right, which is why it's a good idea for people to get tested so they can be informed and make the right decisions. If a child has juvenile onset Tay-Sachs, a disease usually starts occurring between ages 2 and 5. The first signs at that point are lack of coordination, muscle weakness, slurred speech, ability to walk, eat independently, and communicate. These cases are more prone to respiratory infections, pneumonia, and seizures. The earlier the signs are observed, the more quickly the signs will progress. Finally, the adult form, late onset Tay-Sachs, is rare and often diagnosed, but it becomes apparent when the person is in their 20s or 30s. It's not fatal most of the time, and it still involves neurological deterioration and loss of coordination, and the symptoms are speech and swallowing difficulties, cognitive decline, psychiatric illness, deafness, blindness, dementia, increased startle reaction, irritability, loss of motor skills, delayed mental and social skills, paralysis, loss of muscle function, and slow growth. So even though these are a lot of symptoms, with this form of Tay-Sachs, the symptoms can actually be controlled with meds usually, and the person can, most of the time, live their life normally if psychiatric and physical difficulties are accommodated for.
I was actually just about to ask, what are the ways to fight this disease if it already exists?
Well, there's no ways to lessen your risk or fight the disease, but with a healthy diet and right meds, you can greatly improve the symptoms, making life more comfortable. Also, there are support groups available.
Wow, so how exactly is it determined whether or not this disease will be passed on?
Well, a child has to receive 2 copies of the defective gene to express it, meaning be sick with Tay-Sachs, because it's an autosomal recessive disease.
I'm confused.
Right.
You're using some pretty big words here, Doc. I think
I'll
you got
show you
drawn
how it
out.
works. Alright, so say your husband is a carrier, but you're not a carrier. This is what the Punnett square would look like. This represents you, and this represents your husband. This is the disease since it's recessive.
So the little t is the disease.
Right.
Okay. So what does that even show?
Okay, so if this was the scenario that one of you was carrier, one of you wasn't, there would be a 50% chance that your child will carry the disease, but they wouldn't be able to have Tay-Sachs themselves and suffer from it. There's also a 50% chance that your child won't even be affected at all by the disease or carry it.
Oh, okay. So what would happen if both of us were carriers?
Okay, in that case, Alright, so if you guys both carried the disease, your child would have a 25% chance of not being infected or carrying it at all, a 25% chance of expressing Tay-Sachs disease, and a 50% chance of being a carrier but not actually being infected.
Oh, okay. I get it. So, well, I would definitely like to be tested after hearing all this. Can you tell me how that process works?
Okay, well for Tay-Sachs, a genetic test would be done in order to determine whether or not you're a carrier. Gene tests can be done usually by blood tests to measure levels of proteins and hormones to predict the risk of disorders. The test then is sent to a lab for analyzing, and you may have the results mailed to your doctor or I, and we'll call you with them. The only thing I want to warn you about is that blood tests are generally accurate when speaking in terms of sensitivity, but not as much in terms of specificity. In other words, they're accurate in picking up the disease when it's present, but they also have a high rate of false positives, so even if the results come back positive, you may just want to get tested again to confirm the results.
Okay, well, what if I may already be pregnant? Then what would I do?
Well, there are tests called amniocentesis and chronic villus sampling, which can be done by extracting some fluid from the sac surrounding the fetus, and those cells contain the full genetic code, so they can diagnose fetal abnormalities of the child. Amniocentesis is done with a long needle that's inserted into the uterus through the abdomen, and although it sounds really invasive, women usually only report minor discomfort, and an ultrasound is also included in that test.
So, is this a common procedure, and if I was pregnant, would it increase the risk of miscarriage? Because that sounds pretty scary.
Well, it doesn't increase the risk of miscarriage at all, but the American College of Obstetrics and Gynecologists now actually recommends that all pregnant women be offered the option of genetic testing, and the test is actually more likely to be prescribed if there are risk factors such as family history, exposure to environmental toxins, etc. So, do you think you may already be pregnant?
I don't know.
Oh, okay. Well, don't worry about not being able to find out. If you're pregnant and you want to be tested, you still can be tested with those tests. Even if you're pregnant, you can have amniocentesis done. Some people who choose not to have that procedure get a biochemical test done when the baby is born, but I agree with your choice to get tested now, and it'll allow you and your husband to make the appropriate decisions for your family.
Should my husband also be tested?
Yes, this will give you a better idea of the chances of your child getting the disease, and you can find out if either of you guys are carriers. So here's the information for the medical geneticist. You can call and make an appointment with me or them.
All right, thank you so much.
Okay, you're welcome.
All right, so I'll call you when I get the test results back.
Okay.
All right, thank you so much. Nice to meet you.
Bye.
Bye. Hello again, and welcome back to BSU Tonight. Thank you for tuning in, and I hope you enjoyed our presentation about Tay-Sachs disease.
And remember, if you're planning on starting a family sometime soon, genetic testing is always an option.